Stigma is one of the leading barriers faced by people with disabilities around the world, yet global evidence of how it's addressed is lacking.
This is why Sightsavers joined the Disability and Mental Health Program, Ghana Somubi Dwumadie, and conducted a study with partners on the design and delivery of stigma reduction activities. This research gave us suggestions on what works to reduce the drivers of stigma and the impact it has on people's lives.
One key to success was the diversity of people who participated in the program. Through their lived experience and knowledge, people with disabilities and mental health conditions informed the design and delivery of social behavior change activities. For example, people with disabilities led the design and testing of materials to be used in their communities, which were both accessible and culturally relevant. This increased the acceptability and local ownership of materials.
We organized a day at the Savligu Common Market to explain and then to sensitize the general public on the negative perception towards people with visual impairment. We also have opportunity to simulate radio on 1 hour program to sensitize the general public.
People with disabilities were also supported to become local champions,
such as inclusion ambassadors, advocates, and leaders of self-help groups. These champions became community catalysts and led the work on reducing stigma in their communities. They demonstrated the capacity of people with disabilities to be leaders within their communities, while at the same time increasing their own confidence and capacity.
We have seen that they have created the awareness, and society must see to its success and be ambassadors wherever we find ourselves.
The empowerment and leadership of people with disabilities is vitally important.
But early evidence in Ghana showed us that this alone was not enough to effect significant change. Influential community and religious leaders can open doors and provide access to resources for stigma reduction. They can appoint people with disabilities to decision-making bodies and share stigma reduction messages in local information settings. Local authorities can also set and enforce laws that address discrimination.
Now people have become more responsible. There was a man who lived down there. He is physically disabled. He could hardly support himself when he wants to attend to nature school. The mother will beat him, thinking it's a problem for her, but since she realized she can be arrested when reported, she has stopped.
The involvement of these people in power plays a crucial role in creating a supportive environment for positive norms and behaviors to flourish. In Ghana, experiences in stigma reduction vary depending on a person's gender and disability. Our study found that men dominated leadership positions in self-help groups and organizations of people with disabilities, and in activities, the representation of people with hearing impairment was generally low due to a lack of sign language interpreters. To truly consider the different experiences and needs of stigma reduction, a gendered and intersectional approach is required.
Through our study, we found that a toolbox of approaches has been effective in reducing the different drivers and impacts of stigma.
People with disabilities are key players in changing stigmatizing norms, but they need support to ensure self-stigma is addressed and that gender and disability in all its diversity are considered. The programs committed to reducing stigma as a barrier to disability inclusion, an overarching strategy can help increase alignment, aid collaboration, and help to prioritize the reduction of stigma.
Our findings and recommendations can be explored in the report at research.sightsavers.org/reducing-stigma or scanning the QR code. If you would like to learn more about mainstreaming disability stigma reduction in your work, please get in touch.